Hi, my name is Dr. Lou Jacobs, and I am the owner of Jacobs Chiropractic Acupuncture Center in Portland, Maine, as well as Perinatal and Pediatric Chiropractic of Maine. I'm a pediatric and perinatal specialist within the realm of chiropractic. And one of the things that we talk to a lot with the moms that come to our office is dystocia. I see a lot of women from the beginning of pregnancy through the entire duration of the pregnancy, and one of the common fears that women have is having a difficult, prolonged labor, which is what dystocia is. So we're going to talk about a few basic concepts within the realm of dystocia, and hopefully give you some ideas of how you may be able to reduce your risks of having a C-section as a result of a difficult labor. One of the leading causes of dystocia is CPD, cephalopelvic distortion. Essentially, this is where the doctor says that your baby's head is too big to pass through the birth canal, or that the expulsive forces of the uterus are not strong enough to push the baby through. 2/3 of women who have babies with heads that are considered too large to pass through the birth canal do end up going on and delivering children vaginally, but when one is told that they have cephalopelvic distortion and the baby's head is too big, it does oftentimes lead to having a C-section, which many women would like to try to avoid. So CPD is something that you want to be aware of going into labor and delivery, knowing full well that oftentimes the baby is able to be easily delivered if patience is there and you're able to take your time. The baby will make it out okay. It is considered to be, CPD is considered to be one of the leading causes of dystocia, though, as I may have mentioned, and dystocia leads to 50 to 60% of the C-sections in this country. One of the leading obstetrics textbooks is called Williams, and in Williams' textbook of obstetrics, they give 3 primary reasons that dystocia occurs. And the first one is abnormal expulsive forces. What does that mean? It means that the uterus and the contractions of the uterus are not coordinated and strong enough to push the baby out through the birth canal. Why is this important from a chiropractic perspective? It's important because abnormalities in pelvic alignment and spinal alignment that lead to poor nerve control over the muscles of the uterus and the expulsive forces will lead to a weakness in the expulsive forces. The ability for muscles to contract and push and coordinate, it's a function of the brain, and the brain communicates to these structures of your body that help deliver the baby through the nervous system. If there's any type of interference in the nervous system, those expulsive forces may be reduced, and it may lead to a difficult or prolonged labor. As a slight side note here, from a chiropractic perspective, our job is to remove interference in the nervous system so that the communication from the brain down through the nervous system to the different parts of our body involved in labor and delivery are working at their optimal level. Just a tiny little bit of pressure. The amount of a weight on the amount of the weight of a dime on the back of your hand is enough to really significantly reduce communication within nerve fibers. In fact, up to 40-50%. It's not a lot of pressure. So if things are not properly aligned, you're going to get a reduction in communication, a reduction of control, and again, less than ideal functioning in your body during labor and delivery. This complex of misalignment and tension and inflammation and pressure on the nerves is called vertebral subluxation complex. The second leading cause of dystocia, according to Williams Obstetrics, is abnormalities of the maternal bony pelvis. Basically what that means is that things are either genetically malformed in the bones of your pelvis, or there's some type of distortion, some type of abnormal position or movement in the joints and the bones of the pelvis and sacrum that are not going to allow for the baby to pass through the birth canal. We're talking about a very limited amount of space in there, and any time that there's any type of mild subluxation of the joints of the pelvis, it can produce just enough abnormality and pressure that the baby's not going to descend and be delivered easily or at all. So abnormalities of the maternal bony pelvis are the second leading cause of difficult or prolonged labor. And this is something that as a chiropractor, we are very capable of helping with and correcting so that your labor and delivery may be easier if indeed that abnormality of the bony pelvis is identified. The third and final major reason, or of the three major reasons, the third and final reason for dystocia or difficult prolonged labor is abnormalities of presentation, position, or development of the uterus. What does this mean? Imbalances of the muscles, of the tension of the ligaments. The round ligament is a very unusual ligament that's attached to the uterus, and it's unusual in that it is a ligament with muscle fibers woven into it. It's the only ligament in the body with muscle fibers, so it can become very tight, contracted, and almost form a knot like you might get in your shoulder. But what it does is it pulls the uterus out of normal position, okay? And when the uterus is not in normal position, the labor and delivery is not going to develop normally. So anything structural that leads to malposition or dilation during labor and delivery is going to create problems. Again, one of the things that we deal with in chiropractic that makes us so valuable during pregnancy leading up to labor and delivery is that we can adjust the pelvic structures in such a way that you get the most symmetrical tone in all of the ligaments, tendons, muscles, and bones of that area, which doesn't guarantee that things are going to go perfectly, but it puts you at much greater odds in terms of having an easy labor and delivery and not finding yourself in this position where you're told that this dystocia, this prolonged labor has gone on too long, the baby's in distress, and you're going to need to have an emergency C-section. It happens a lot. It doesn't have to, but I hear stories of this quite frequently in patients who have not received, women who have not received chiropractic during their pregnancy. Again, it's no guarantee, but you want to put the odds in your favor of having a pelvis that is going to support labor and delivery at its optimal level. Chiropractic is an amazing choice, and it's drug-free, it's surgery-free, it's very, very safe. With this theme of abnormalities of presentation, position, and development of the uterus, there is a technique that is quite popular that I'm going to talk about in a moment for when these structures are not positioned properly and they cause the baby to present in a breech presentation. The technique is called Webster Technique. It's a chiropractic technique, and I'm going to tell you about it right now. The Webster Technique is a technique that was developed by a chiropractor by the name of Larry Webster. He's also the founding father of the International Chiropractic Pediatric Association. He was trying to develop a chiropractic technique actually for his daughter, or after his daughter had a difficult labor. In her name, he was trying to create or figure out how chiropractic can help ease labor and delivery, which is what this discussion of dystocia is all about. And in the process of trying to figure out how to make labor and delivery easier, he found that women that were presenting with breech babies had similar issues structurally. So he found that oftentimes the sacrum was misaligned. There was a subluxation of the sacrum, which, for those of you who aren't aware of where that is, that's this bone right here, sort of often referred to as the tailbone, but it's this whole triangular unit here. Misalignment, subluxation of the sacrum, and a knot or tension in the round ligament that is attached to the uterus in the front of your body. Okay, so the sacrum is in the back, round ligament is in the front, and when you find tension in the round ligament and in the sacrum, what he found is that by correcting the tension, alleviating it, and repositioning the sacrum, the baby was able to move from a breech presentation into a head-down position. Okay, and this is really, really important if you're trying to have a vaginal delivery, because for the most part, obstetricians these days will not attempt to deliver a baby vaginally that is breech. So, without the use of painful manipulation of the belly or trying to move the baby into position through external cephalic version, what we can do is we can reposition the pelvic structures and allow the baby to feel comfortable moving in to the head down position. If you can imagine being in a uterus, in a belly, and having a bone that's touching your head shift just slightly and push into your head, you're probably going to move into a different position. And this is basically what's happening in a number of cases where babies turn breech. In my office, we have between an 85 and 90% success rate with correcting this subluxation of the sacrum, removing tension from the round ligament, and watching the baby, sometimes immediately, sometimes over the course of weeks, turn into the normal birthing position. This is not a breech baby turning technique. This is a chiropractic technique that normalizes body structures and facilitates the baby's natural movement into the proper birthing position. The baby knows that it needs to be head down and in a particular position to come out. And it's not going to go into that position if that position is uncomfortable. They're smart even before they're born. My hope was to just give you an idea of what dystocia is all about in a nutshell, based on a medical textbook, Williams Obstetrics, and then also show you that chiropractic is a magnificent option for you if you would like to attempt to have not only the easiest pregnancy structurally and neurologically and have your body functioning optimally as you're growing this baby, but also for the easiest labor and delivery. The majority of the issues, the top 3, according to Williams Obstetrics, that will lead to dystocia, and including a baby whose head is too big, the leading problems that lead to dystocia are correctable or helped through chiropractic care. If you have any questions at any time, don't hesitate to contact me. This is my specialty, and I can help you navigate your body and the system to an easier labor and delivery. After I talk to moms outside of the office about dystocia, they often ask, well, when's the best time to come in and get checked out to see if I may be prone to problems during labor and delivery? And I tell them, you know, the earliest you can get in, the better. The earlier you can get in, the better. Because if we find issues that have been around for a really long time, let's say your pelvis is misaligned and it was that way from the time that you were 5 when you fell off your bicycle, it's probably going to take more than 1 or 2 visits to correct that. So if you're coming in right before labor and delivery, a week before your due date, 2 weeks before your due date, we may not be able to provide you with the best possible care simply because we don't have enough time. So an exam is performed that's very non-invasive at the beginning of care, and we determine what you're going to need to establish the most optimal structural and neurological positioning and control over your body. And if you come in early and we finish care early, fantastic. You're set. You're ready to go. But waiting until the last minute is probably not the best idea. But you call the office. We'll get you in as soon as possible. Moms always have priority here, and children as well. And we will do our best to prep you structurally and neurologically for your labor and delivery. Thanks for watching.